Happy Monday, everyone. Here we are, another Facebook Live at Cancer Center for Healing and Center for New Medicine. I am Kitty, and tonight you will be enjoying Ariel Causey, our nurse practitioner here at the Center for New Medicine, and she also deals with everything from common cold to cancer. So I wanted to make sure to let you know, and I'm going to read this a little bit, but our goal is to educate and empower and illuminate the cure for cancer, which is prevention. We have about 50% of people being diagnosed with cancer every day. 1,600 people die a day, but no one says a thing. They'll talk about a plane crash, but they won't talk about someone who dies of cancer. So at Cancer Center for Healing and Cancer Center for Healing and Center for New Medicine, we want you to know. We want you to know the truth. We want you to spread this word. We want you to share with your community, because community is healing to us. So you're going to see each and every week something that's educational that you can take away. There is no sales to it except to educate and empower you. And we want you to fight the fight with us. So please share these videos with your family and friends. And with that, here's Ariel.
Hi guys. So today my talk is going to be regarding brain health and a healthy lifestyle. So how to keep your brain nice and healthy as well as the rest of your body. So your brain is an organ system, is part of your body, as well as the rest of your central nervous system, typically known as your CNS. And so today's topic is going to be going over a lot of techniques to help you to prevent the onset of certain problems like dementia and Alzheimer's, but also just in general to help keep your brain nice and healthy throughout your whole life. So as you know, with any disease process, there's a multitude of ways that people can get that disease process or have issues with their brain function or other organ systems. So biggest thing here is prevention. And other than that, we can always go back and try to do what we can, but as we know, the brain has limited resources in order to help fix and repair itself. So it's really going to be key and ideal that we do everything we possibly can to prevent those damages from occurring in the first place. So one of the key things I really wanted to talk about with you all today is making sure that as part of a healthy brain, we have a healthy lifestyle. So part of that is definitely going to be your diet. So looking into causes that can deteriorate your brain over time or your nervous system would be things like high blood sugar or diabetes. So that's something we'd really want to stay focused in on, and making sure that we're keeping blood sugar as low as possible. So when you have issues with high blood sugar or diabetes, and you don't have to be diagnosed with diabetes to have issues with blood sugar management, you can simply have insulin resistance. But sugar doesn't tend to stay liquid inside your body. It stays crystalline, and it can cause a lot of inflammation inside the body, especially in the vasculature. So if you have less blood flow and circulation going to a certain area, you're going to have a higher tendency towards death. So that can be what we call ischemia, or the loss of function in a certain organ system. That can be in the heart, that can be in the brain, and so you can have ischemic attacks in multiple places inside the body, even on the skin. So when we look at things like having ischemic events, a lot of the root of that cause of issue or illness is inflammation. At the root of all inflammation is pretty much sugar. So really looking at sugar metabolism as something that's really going to help to prevent the onset of ischemic attacks in the brain, which can be called transient ischemic attacks or TIAs, or a cerebral vascular accident. And those can be ischemic, meaning loss of blood flow and circulation, or hemorrhagic, where you have a bleed in your brain. And those can be much more life-threatening if it's an active bleed, but those are far less common. Generally speaking, for blood sugar management, what we're looking for is basically what I would consider a brain healthy diet. So that can be anything like ketogenics, paleo, even a modification of those, Mediterranean, things that are high in dietary fats, particularly plant-based fats. So we're really looking at things like avocados, nuts and seeds, and fish for healthy fats. Those are going to help encapsulate nerve cells, which we would call the myelin sheath, or the healthy cholesterol coating we keep on every single one of our nerve cells. So a big part of that is really going to be coming from your diet. Of course, you can take supplements to help with obtaining those, but generally speaking, the more you eat of those things, the better off you'll be, because then you're not going to be taking 40 or 50 supplements a day. You'll be eating your nutrition and your health and keeping your brain nice and healthy that way. Another key thing is going to be keeping the sugars low. So when we talk about things like a ketogenic diet, paleo, or Mediterranean, they tend to be lower in glycemic index, meaning that there is a less of a focus on things like bread, pasta, potatoes, rice, and corn, as those tends to have a lot of complex sugars that essentially will break down into sugar. And then obviously eliminating things like cookies, candies, cakes, or having very limited quantities of that. Also reducing alcohol consumption, as that can pertain to your blood sugar level as well, as that's typically predominantly just sugar. Then we really want to limit that intake as well. As most people know, higher amounts of alcohol consumption can lead to very rapid deterioration of nerve and brain cells as well. So people who drink consistently tend to have more issues with memory and cognition as a whole. So in general, limiting that as well is going to be very important for you. Aside from that, also making sure that we eat plenty of vegetables and have a low intake of fruits as well, because fruit is essentially sugar. So aside from all of those factors in regards to your diet and nutrition, we also want to make sure that blood pressure is well managed. So going back to the whole circulation in the brain, we want to make sure that there's plenty of blood flow and circulation getting to the brain. If you have really high blood pressure, then the likelihood is that the small capillaries that cover our brain or are located on the interior of our brain, even going to our extremities where some of our nerves are, the higher the blood pressure, the higher the likelihood is that we'll have some death to those nerves because there isn't enough exchange of nutrients and oxygen flow. So oxygen is going to be very important in making sure that we're maintaining nice, healthy, working nerve cells. So making sure the blood pressure stays low. So if you have problems with that, there's a lot of natural items that you can utilize to kind of help keep the blood pressure nice and low, or making sure you're staying on the medication regimen that's been recommended to you by your doctor or healthcare professional. But keeping blood pressure well managed is really going to be key at maintaining brain and healthy nerve function throughout your entire life. So that's going to be optimal. Another issue that we would be looking at is basically keeping inflammation at a low too. So patients with autoimmune conditions, making sure that beyond taking anything that may be recommended by your rheumatologist, that you make sure you eat a diet that's high in anti-inflammatory foods. So those would be eating the rainbow is what it's called, a nice variety of different fruits and vegetables that are rich in intensity in their color. That means they're high in antioxidants. Antioxidants are the key to reducing inflammation inside the body, and most of them are going to be plant-based. Now, if you don't feel you're getting an adequate diet, or you have an amount of inflammation that exceeds what you're able to consume, then sometimes taking a supplement would be beneficial to you. So supplements can vary depending upon the degree of inflammation that you have inside your body, but some common ones would be like curcumin or omega-3s. Those would be probably the most commonly used anti-inflammatories that we see, and tend to have a lot of cardiovascular benefit to patients, as well as decreasing inflammation throughout the body. They work in different pathways at blocking certain proteins that stimulate the immune response and help to calm it down. So even patients with autoimmune conditions, they would tend to benefit greatly from taking some of those natural products in conjunction with anything else they may be doing by their regular doctor. So that's really going to be very, very key at maintaining healthy brain function, reducing your overall risk for things that are neurodegenerative like Alzheimer's disease or dementia. In fact, these days, Alzheimer's is being referred to as diabetes type 3, so kind of tying back into the inflammation and the sugar metabolism aspect of that. So making sure that we're managing all of those aspects of our diet is going to be hugely important and paramount in order to help us maintain our brain health. Then going forward, I would just also want to make sure that you have a diet rich in B vitamins, that they're going to help with the relay of nerve messages inside of the brain itself, and helps with healthy metabolism in the mitochondria. So the mitochondria is our powerhouse, our energy manufacturer inside the cell. And so in order to have good cellular communication, which is really something we need from our nerve cells to need to be able to communicate messages from the brain all the way down to our fingertips and toes, then B vitamins are hugely important. So unfortunately, a few years ago, insurance companies did do away with paying for medical foods, but before then, pharmaceutical companies even would invest in looking at how nutraceuticals may improve a person's well-being. And one of the things that was approved for diabetic neuropathy was a B6, B12 combination that had clinical significance at improving diabetic neuropathy. Well, we can look at the dosages and exactly what was involved with that medication, and we can give that to you at a fraction of the price of what that pharmaceutical had you pay, and you can get the same benefit from it. The reason being is these are universally understood that these vitamins are necessary for basic cellular function, but specifically in our brain. Our brain takes over the majority of our metabolic need in several instances. So if we eat sugar, it instantly goes to our brain, which is why people feel that sugar rush. So that sugar rush is all of that stimulation going directly to your brain, feeding all of your neurons, and then after they've exhausted themselves, are completely burnt out, and then you have your sugar crash. So a lot of nutrients end up going directly to the brain. In fact, if there's any issue that's going on in the body and where we start diverting blood flow, it's always going to go to your brain and to your heart. So it's best to try to preserve brain function as best we can, and like we were talking about, diet is going to be one of the best ways that you can control almost any health condition that you have, as well as preventing things from occurring as well. So continuing along that path, I'd also want to touch on the microbiome and how that perceives in your neurotransmitter balance inside of your brain. So our brain functions by communicating with each other through certain proteins we would typically call neurotransmitters. And basically speaking, these neurotransmitters communicate to each of the nerve cells in a variety of ways. They pass their information from one cell to the next, and then it has a cascade-like effect. Unless, similar in a case of dominoes, there's a missing piece, in which case it can't correlate its message, and that message will become lost. And that can happen when you see something like a spinal cord injury, where the message from the legs or the arms can't get back to the brain because that message has been severed by some type of trauma or injury. So in that same pathway, looking at neurotransmitter balance and making sure we have enough of those communicators to communicate effectively is very important. So when we look into brain health like mood disorders, like depression and anxiety, those are typically disorders of neurotransmitter balance. And so neurotransmitters are greatly affected by our gut flora. So our gut flora and the environment it creates in our gut accounts for approximately 70% of our neurotransmitters. So we only have maybe 30% that sits in our brain and our CNS, our spinal cord. So that leaves very little open for the brain and CNS to use. So if we become deplete of serotonin, norepinephrine, dopamine, those are all examples of neurotransmitters in our gut, then we're going to have issues with the way that we think and the way that we communicate messages in our brain. So depression is typically a depletion of things like serotonin, norepinephrine, dopamine, and we can also see changes in other neurotransmitter balances as well for other conditions. Things like acetylcholine can occur in myasthenia gravis, or dopamine release in things like Parkinson's disorder. So in terms of regulating those, our microbiome plays a huge role because it does create that environment that encourages the use and the development of neurotransmitter balance inside of our body. So typically when people say they have an anxious stomach or they feel butterflies, it's typically as serotonin starts to shift inside the gut, you start to feel actual physiologic changes, such as gurgling in your stomach, maybe even the spasming of your intestinal tract as you begin to have this depletion or shift in your serotonin levels. So it's hugely based in the gut, and so what you put into your gut in terms of a microbiome is going to make a huge difference. So some patients actually have gut infections that we can look at. So those could be something like SIBO, candida, yeast, parasites, and all of those can change your neurotransmitter balance. In fact, I've seen it time and time again on several patients that they'll tend to report more issues with depression and anxiety when they do have some of these gut infections. And typically, I can throw all of the antidepressants I want at their condition in the world, and it still won't change the way that they're thinking and feeling, simply because it starts in the gut. And so if you don't resolve the initial issue that's causing it, you're going to continue to have that same problem. So people will outlive or move beyond what their antidepressant should be doing for them, and they'll end up needing more and more over time. It's not necessarily always a tolerance issue, although it can be in some patients. A lot of the times you didn't fix the initial problem that was causing that. So generally eradicating those infections in the gut, cleaning up the diet, that's going to be huge for eradicating a lot of those conditions. So even things like schizophrenia and bipolar disorder, not to say that it would completely solve those issues, but you'd have a significant degree of improvement to those signs and symptoms if you did have an optimized diet protocol and lifestyle management. So generally speaking, it's about diet, it's about the perfect kind of supplements, and about an exercise regimen that's going to definitely help you to sustain brain function lifelong. So moving forward with that, looking at things like exercise and how that can affect your brain health and keeping you nice and fit. So exercise has been shown in a multitude of ways to help to reduce a lot of complications that we already talked about for brain health. So exercise reduces inflammation. It increases blood flow and circulation. It helps to stimulate the release of growth factors. It also helps with the circulation of hormones, which plays a huge role in brain health as well, which is why we tend to see a larger decline in females after they go through menopause in terms of brain function. In fact, their risk for Alzheimer's and dementia gets significantly worse, pretty much doubles after they go through menopause in comparison to men of the same age group. So with exercise, not only does it help reduce a lot of those factors, controls blood pressure, it also reduces stress, anxiety, improves sleep patterns. Generally, you get better rest and better sleep, and it also helps you with problem solving. So a good way to help to maintain a lot of nerve junctions and functionings. In fact, we can even create new nerve cells if we need to, if we had minimal amounts of damage to our brain or our nervous system. We have stem cells, and they'll go in and be able to repair a job as long as there's enough support for that to occur. So blood flow, circulation, there isn't continual injury that's going on to the brain or to the nerve cells themselves, then your body actually can cause or create repairs. Also, similarly functioning, if you do a lot of problem-solving exercises or critical thinking activities, then you can create new formations inside of your brain and nervous system as well. So that's going to be really important going through your whole life. So exercise is something that generally people probably don't think about, but is hugely, it has a lot of correlation to problem-solving and critical thinking. And then depending upon the exercise or activity you're doing, can also have teamwork that's associated in with it, and that's another version of problem solving, communicating, and how you're going to work through that. So it's very good for brain health that they've shown that actually there's a significant difference between patients who do have physical activity and exercise in their daily routine versus those who don't. And generally those who do, because of their blood flow and circulation, decrease inflammation and improve mood because of their exercise, their brain volumes maintain themselves much longer throughout their lifespan than those who don't. So exercise is going to be very huge.
Perfect. We actually have a question.
Oh, yes, there's a question.
How does pharmaceutical drugs like sleeping pills and anxiety medications contribute memory loss and even cancer?
Can you repeat the question one more time?
How does pharmaceutical drugs
like sleeping pills
and
anxiety medications
contribute to memory loss and even cancer?
So in the same regard that I was speaking to before, it can contribute to the development of other disease processes, even cancer, because you're not fixing the initial injury. So a lot of the time these symptoms that you're having, mood disorders or changes even to your gut health, you may not understand what they mean, and sometimes even conventional doctors may not understand all of the meanings behind them. But generally speaking, it's your body giving you a warning sign that something is going wrong, something is off here. And it's not always a mental thing, something that you're just perceiving differently. Sometimes there are physiologic changes to your environment. So it could be your outside environment that you're having difficulty dealing with the stress. And so you may need some emotional work, and that's okay. Everybody needs emotional work. Everybody on the planet does. Nobody is perfect. But also making sure that physiologically too, inside of the body, that there aren't any significant changes like those infections that I was talking about. So if you give something like a sleep aid or something to treat depression or anxiety, you're not looking at the root cause. You're not coming up with what the actual answer is. And sometimes they may be prescribed in a short-term period to help patients so that they can get to a point where it's easy enough to talk about what's been going on in their life or to address the infection. So we wouldn't want anybody to cause self-harm because they feel a certain way or have a certain mood disorder. Definitely you need sleep to be able to continue to function and be reparative and regenerative, but there becomes a certain point in time in which your behaviors have become maladaptive and we may need to get on top of them, but the medications are always intended for short-term use. They should never be used long-term. There are very, very, very few patients who require it for long-term.
Great, perfect. And then if you want to.
Yeah. So then going back to our environment and kind of how that comes into our brain health. So looking into our external environment, there's a lot of things that can participate in that. So obviously everybody has a lot of daily stress from their jobs, from their home life. Let's say your car broke down. So there's a lot of things outside of your head and your body that are causing input that you need to respond to. And so that in and of itself can create some imbalances inside the body. Like we talked about, nervous stomach before. So external environmental stressors can definitely change the stressors or environment inside of our bodies. And so looking at ways that we can help to control that. So one of the things I like to talk about in regards to brain health would be looking at reducing external environment waste products or toxins that could be getting into our brain and causing problems. So those could be things like pesticides, those could be things like painting your house, those could be things like washing your car. There's all kinds of chemicals and detergents that can be used within our daily lifestyles that can cause a lot of problems in our mentation. The biggest ones would be things like organic solvents. They have the ability to instantly cross the blood-brain barrier. There is nothing prohibiting them from crossing over, and they cause the most amount of damage. And those would be included in that would be phosphates, pesticides, and then even going further, some of the things that we may have in our food supply as well, or water supply. So you just have to be very careful. So ideally speaking, having water filters for your water sources, even for areas where you intend to bathe, because we do absorb things through our skin. So our skin is our largest organ on our body, and sometimes we absorb things better through our skin than we even do through what's called the oral fecal route, or going through our digestive system. So making sure that there's a filter system that you have installed through all of the water that you're going to utilize throughout your house, because you can have contaminants throughout the water supply throughout the house. Then looking at reducing other environmental exposures, including lead paint that could be found in walls. Depending upon the area in which you live in, certain places in the United States have an increased amount of radon that's in the ground innately, or prior places that have, such as New Mexico, Arizona, where they may have done atomic bomb testing several years ago, could have some radiation exposure still in their soil, still in their groundwater. So it's very important to know about your environment and what's around you and how that could be influencing your brain health overall. And going into that a little further too would be looking at things like heavy metal exposures and heavy metal toxicity. So heavy metals definitely interfere with our body's ability to replicate its own DNA, and also with energy metabolism, or how we make energy. So in terms of brain health, typically speaking, that's going to interfere with mitochondrial ATP production, its ability to have high cellular communication like we were talking about before, and interfering with its ability to create or utilize certain vitamins like we were talking about. So some patients may end up needing to use something like a methylated B vitamin because they may have heavy metal exposure, which is interrupting their ability to take what they're eating and turn it into what they need to utilize inside their body in order to make it functional. So that happens a lot of the time with heavy metals. We can also see that over time, heavy metals have a tendency to get stuck in certain locations, such as the brain, liver, kidneys, and other organ systems inside the body, and they don't have a way to eliminate themselves. So they tend to stack on top of each other. And nerve cells are very specific in that if improper proteins or something of a heavy weight stacks on top of it, eventually it will cause cell death. So we see that in Alzheimer's or other prion type diseases, where there's a misshapen protein that folds on itself over and over and over again until eventually the weight of it causes eventually cellular death, in this case nerve death. So with heavy metals you can have similar issues. So with heavy metal toxicity we can definitely see changes to cognition, and to brain function over the long term. It also causes a lot of cardiovascular changes as well, so then we would also see the nerve death in combination with cardiovascular issues such as decreased blood flow and circulation to the brain, so an inability to repair damages as well. So heavy metals are key. A lot of the time patients are able to help eliminate those things if they were working on it with their healthcare provider and were able to determine that's what was going on. There's a number of ways you can remove heavy metals from the body. It just usually takes time and is a process because it does have to end up being eliminated through the body some way. So typically through kidney or fecal excretion. And sometimes we can also utilize the skin if the burden is too great on some of the other organ systems. So that would be something that would be discussed with your healthcare provider and could be something to look into if you feel you are prematurely having any cognitive decline. But heavy metals do play a huge role in that. And so that would be looking at environmental exposures and problems. Okay, so lastly would be making sure that your environmental stressors too, if they are affecting your mood in a way that you feel that nothing else has been able to help with, that the underlying cause may be that you just perceive something slightly differently than other people think you should, then always making sure that we go to the root of that emotion, making sure that we're getting to the actual answer instead of saying, well, I'm mad at so-and-so because they spilled this and that, when maybe it's because when we were children, our older brother or younger sister always spilled this drink, let's say, and now we're upset that somebody else spilled that drink because it was unresolved anger or resentment that we had towards that event when we were younger. So sometimes we look at it as it has to be an event that happened right here and now, when instead it could just be a stressor or a trigger from an event that happened before. So making sure we really get to the underlying cause of all of these things that can tend to reside in our body and overall do tend to cause a lot of diseases and illness. So our mentation and our thinking is part of our brain health, and if we have a certain thought process such as depression, if we look on thermography scans, blood flow and circulation slows down throughout the entire body. In fact, our bodies cool off overall when we're depressed. When we're anxious, similar things can occur. So when we slow down blood flow and circulation to other areas, then you can have areas that are underfunctioning or may die off or have other diseases that develop inside of them because they're not getting the exchange of nutrients the way that they're supposed to. So more than just the way that we're thinking, our thoughts influence our entire body. So looking at brain health is really looking at body health. And that's going to be huge, huge in your entire body in terms of prevention. So making sure we control our emotions for brain health as well. Okay. And then one of the last things I'm going to touch on a little bit more on an internal basis that I briefly touched on was hormones. So when women go through menopause, and men can go through a similar condition as well, where they have androgen deficiency or testosterone deficiency, and their bodies just aren't making as much as they used to. When women go through menopause, it is a finite point in time in which they stop making estrogen, progesterone, and testosterone, simply because there are no more eggs in reserve in the ovaries, and that's the only place in the female human body in which you can receive those hormones. So once women go through menopause and aren't receiving any hormone replacement, that's pretty much it. After that point in time in women, we see a significant increase to not only brain changes like Alzheimer's and dementia and mood disorders like insomnia, depression, anxiety, but we also see a huge correlation to cardiovascular disease, heart attack, stroke, pulmonary embolism. Even certain types of cancer can arise after that point in time because there's simply estrogen, testosterone play a huge role in how our body receives circulation and how well certain things are functioning, including metabolism. So again, going back to metabolism, our brains are a hugely metabolically active area, and so it requires a high amount of metabolic activity. And so estrogen, testosterone, and other hormones play a huge role in that ability to do those things. So one of the things we would look at in terms of prevention, especially for a postmenopausal woman, for preventing Alzheimer's and dementia would not only be to look at hormone replacement therapies to make sure that at least you're getting a small amount lifelong of hormones that you would otherwise have this ebb and flow or fluctuation of. You can get a smaller amount of it on a chronic basis and be able to preserve the functionality of a lot of different organ systems, including the brain. And then another hormone that gets turned off in menopause is one called pregnenolone. And pregnenolone is really the precursor to all other hormones inside the body in terms of androgen hormones, and we call it the grandmother hormone. And essentially speaking, the biggest functionality it seems to have is reducing inflammation specifically in the brain. So we find that if we give patients a higher amount of pregnenolone on a daily basis, then generally speaking, they're going to have fewer end results of chronic neurodegenerative disorders. We even give it to patients who have traumatic brain injuries and are on the process of repairing or recovering from that as well. So definitely making sure that hormones and hormone replacement is something that would be discussed with your healthcare provider for men and for women. Typically for women, there's always that finite point in time. For men, it can vary a little bit more. So men can make testosterone their whole life long. Just depends on the rest of their health status and how well they've maintained the rest of their body. But hormones play a huge role in brain health and really the prevention of brain deterioration. Okay. So is there a question? Okay. And then lastly, kind of going over a couple of different treatment options. So I'm going to go over some of the treatments that we do offer here in our offices, as well as some supplements that might be beneficial overall for brain health as well. So when we look at brain health, we're talking about blood flow and circulation. So we offer a couple of things here, like hyperbaric oxygen treatments. And what that does is basically helps to force additional oxygen and blood flow into the body, including the brain. It's frequently used for patients with traumatic brain injury, wound care, wound healing that needs to occur, or people with cognitive decline, because it's basically forcing that action that we were talking about earlier. Oxygen also can have an anti-inflammatory effect and generally can help to get nutrients to where it needs to go throughout the rest of the body. We can also look into some of our hydrogen therapies, and this was something that was developed or found by some Japanese scientists and researchers that found that because hydrogen is such a small molecular weight gas, and it's easier for it to cross through cellular membranes. Unlike oxygen that may require transporters from time to time, hydrogen does not require that. So what they found is by giving this to patients who had traumatic brain injuries in Japan ICUs, that they actually recovered faster versus just being on a ventilation system that supplied them with supplemental oxygen. So they started adding in a small amount of supplemental hydrogen. So you can get hydrogen through one of our machines called an AquaCure. You can purchase it and have it for in-home use, and that in and of itself can help with brain health, brain activity, mitochondrial functioning, ATP production. We've used it with Alzheimer's and Parkinson's patients and has had a lot of benefit for them. You can also use it to help with energy and fatigue from the common cold and other illnesses as well. So hydrogen has a huge role in being able to help heal the body in a multitude of ways, specifically the brain. Okay. You can also purchase it in capsule or liquid form as well, so you can eat it or drink it as well. A couple other things could be another oxygenative therapy like ozone treatments, so you can receive IV ozone treatments. You can also receive rectal ozone treatments if you did have a gut infection that needed to get cleared. Those generally are antimicrobial and will help you to pass any parasites or candida that may be lingering in the gut system as well, versus having to do maybe some oral protocols. So there's a variety of uses for some of those oxygenative therapies in regards to helping with brain health and brain repair, and also brain health prevention. Other things would be looking at our sauna treatments, either infrared or otherwise, basically to help with that blood flow and circulation. But also a sauna has a different characteristic where we help to detoxify our bodies. And what that means is instead of requiring our liver or our kidneys to do the majority of the waste removal, we're asking our skin to do it. So our brain is the most sensitive organ to a lot of those chemicals. So in order to help decrease its burden and help improve how it's acting, not only will the sauna help improve blood flow and circulation to the brain, but it's also going to help us to pull out those waste products so that we can eliminate them faster. We don't have to require our overburdened liver or kidneys to have to force them out over a process of time. So we can pull them out using our sweat glands. And then looking at other things to help with emotional health would be therapy, like using a licensed marriage family therapist or a psychologist to help you through some of the emotional issues. But also in our office we offer some EVOX treatments that can definitely help us to look at what that underlying cause is. So like I was saying before, where maybe today's incident is what upset you, it may have triggered an event that you were accustomed to when you were younger or had a lifelong history with, but we just can't make that connection because we're being blocked by something else in our brain that's usually there to be protective, but it doesn't allow us to work through it. So while in the beginning it probably was helpful for us to be able to block it out or ignore it, now it's a maladaptive behavior, and now it's prohibiting us from getting better. So that's really going to be a problem. So the EVOX treatments are able to help you to uncover what it is that's bothering you by using frequency and vibrational medicine. And that's a new and ever-evolving realm of new types of medicine. So that can also be very beneficial at helping not only your brain but your whole body, because your emotions influence your thoughts and your thoughts influence your whole body. Lastly, looking at some of our IV treatments that we also offer. So one of those would be like a PK protocol, which utilizes phosphatidylcholine, again to help detoxify the body, add healthy fats into the system, and really help to support the metabolic activities that the brain would need. That would move us into some of the supplementation. So that would be something you can do IV. There's a number of other IVs that can be done as well to help with that, including our chelation IVs, Plaque-X, even our cerebral lysin, or other brain health type IVs. Supplementation can also be done. It just depends upon the level and severity of the problem. So if we're looking at prevention or maintenance, some of these may not be necessary, but they're always going to be beneficial and helpful. So two of the ones that I use a lot for cognition, memory, and brain health overall are phosphatidylcholine and phosphatidylserine, and those are typically found in a lot of your healthy fat solutions. Those are part of the myelin sheath that help to keep that nice healthy fat coating around your nerve cells, and also things like omega-3s and other essential fatty acids, so omega-3, 6s, and 9s, predominantly from fish, nuts, seeds, and avocados. So those are going to be really beneficial for brain health too, in making sure that if the nerve cell is not properly insulated, basically speaking, it's not able to communicate its message very effectively. It tends to shift and wobble a lot. And so in that case, it can cause a tendency for the nerve itself to snap or to lose its message as it's trying to travel down the nerve cell. So generally speaking, making sure we maintain that is going to be beneficial. There's a lot of medications that can also interfere with that ability. So those would be medications like statin medications, or things that are going to mess with cholesterol metabolism, because cholesterol is really going to be very beneficial for encapsulating those nerves. So statin medications, also certain chemotherapeutics tend to have an ability. So some of the platinum medications are actually derived from platinum. And so in that case, you would have some neurodegenerative effects, generally degrades the myelin sheath, overweighs on the brain, and you can see some neuropathy that results from the use of those medications. So that would be another application where medications are interfering with brain health. And generally speaking, some of these supplements can help to relieve that. Not only is phosphatidylcholine and phosphatidylserine very helpful for helping with the fat content in the brain, but also it helps to move through phase 2 detoxification, which is the movement of bile salts. And bile salts are predominantly where we actually release a lot of our waste products from. They can sit and live in our liver for a very long time, and eventually speaking, they need to be excreted through bile salts. At least most of them do, as some of them can be fat soluble. If that is not occurring, if it's not moving through the system, you're not going to eliminate them. So a lot of the time, patients who come in with things like chemical sensitivities or multiple allergies, they generally have a problem moving bile salts, and therefore they're overwhelmed with the amount of waste products or toxins that they're exposed to. So phosphatidylcholine and serine are going to be very important for maintaining brain health and helping with that detoxification process as well. As previously mentioned, looking at things like B vitamins, if there are heavy metals involved or a methylation issue, then generally using methylated versions of B vitamins to help you to absorb them a little bit better and be able to utilize them. Things like thiamine are very important as well in terms of maintaining brain health, as well as folate. And then also magnesium. Magnesium has a huge role in the body, helps with how to produce ATP in the body. It helps with muscle relaxation. It helps with mood adjustment. It helps with communication between the cells. So magnesium is a huge major player, and so it also helps with dilating blood vessels and keeping that blood flow and circulation going, as well as keeping the blood pressure nice and low. So magnesium has a multitude of functions for brain health. I recommend it for almost every patient. Magnesium is the number 2 deficiency in the U.S. Most people, second to vitamin D, are deficient in magnesium. So if there's 2 things you could probably do with your day to help with your brain health, would probably be magnesium and vitamin D. Vitamin D also plays a role in mood regulation as well as brain health. It is a fat-soluble vitamin, meaning that it can cross into that blood-brain barrier and does help with reducing things like depression and anxiety because it reduces inflammation. Okay. There's several other supplements that can be utilized. It just depends upon what the case may be going in for the patient. And then the last supplement / medication that can be used to help with brain health that I'm going to mention today would be talking again about the pregnenolone. So adding pregnenolone after women have gone through menopause, or if men have to have lower levels of pregnenolone or have been diagnosed with any neurodegenerative disorder would benefit greatly from that, as it does have that ability to reduce swelling and inflammation within the brain and generally help to preserve as much brain function as we possibly can. So those are the main points that I've had for today. I'm not sure if there's any additional questions regarding brain health that we need to go over, but as always, it's a good reminder of how we can keep our brain nice and healthy, and how we can work on prevention, and how we interplay a lot with our environment and our experiences, and making sure we do everything we can to keep ourselves well as our community well. So I invite you all to contact our offices if you have any additional questions, and I think that's pretty much it for tonight. Thank you for listening.